Several illnesses are on the rise, and there are some changes in local COVID trends as well. Dr. Frank McGeorge here to break it all down in his weekly look at what's going around.
About half of the doctors and hospitals we talk to are seeing an increase in COVID cases across all ages. Now, many also report an increase in those who need to be admitted to the hospital, which is frankly what I'm seeing in my emergency room too. But the encouraging news is most of those being admitted are not severely ill and don't need to go to the ICU. Here's what's going around where you live.
In Wayne County, Henry Ford doctors are seeing quite a bit of COVID in adults. Pediatrician Dr. Jacqueline Metz also reports a COVID increase in school-aged children, with most being unvaccinated. Dr. Kevin Daisy at Children's Hospital is seeing a wave of RSV cases plus bronchiolitis in babies. The CVS Miniclinics are treating strep throat, pneumonia, and a skin infection called impetigo. Moving to Oakland County, several doctors are seeing an increase in COVID patients, most with mild to moderate symptoms. Dr. Stephen McGraw at Ascension Providence also reports patients testing positive for the flu, plus cases of strep throat and kids with ear infections. The CVS Miniclinics report stomach viruses and a rise in bronchitis. Looking at Washtenaw County, Chelsea Hospital reports an increase in adult COVID admissions, but not severe cases. Dr. Brad Uren at Michigan Medicine is also seeing COVID, plus upper respiratory infections and gastrointestinal illnesses. The flu is circulating, but still low. Heading to Monroe County, doctors at ProMedica Monroe Regional are seeing COVID, but not severely ill patients. They're also reporting an uptick in children with respiratory illnesses, in particular RSV. On to Macomb County, Henry Ford Macomb doctors report more COVID admissions primarily in the elderly or those with underlying heart or lung conditions. ER Dr. Ben Dorr at McLaren Macomb is treating several young children with RSV or stomach viruses, plus lots of upper respiratory infections in all ages. Dr. Amanda Lynn Marshall reports an increase in croup at the Beaumont Outpatient Campus in Lenox, and CVS Miniclinics are treating lots of sinus infections. Finally, in Livingston County, Trinity Health Livingston continues to see a number of adults with COVID, but none considered severe. Respiratory illnesses are the major issue in children this week.
Now, if you haven't had a flu shot yet or an updated COVID booster, now is a good time to get that done. And if you're sick, stay home and get tested. Back to you.
All right, thank you, Doc.